Hello, my name is Gangesh Shukla. I'm a second year medical student. Can I know your name and age, please?
Shukla, age 25.
Okay, today I'll be going to inspect your nose, mouth, and neck. Is that will be okay for you?
Okay.
Okay, if you feel any uncomfortability during the procedure, just let me know, okay?
Okay.
I'll check for the first anterior and inferior surface of the nose and the symmetry of the nose. As I can see, there is no dissymmetry or anything. Okay. Now I'll check for the vestibule. Can you please breathe in? Again? Okay. Now I'll check for the nasal septum and nasal mucosa using otoscope using the longest speculum. Is that okay with you?
Okay.
Okay. As I can see, there is no tenderness, no epistaxis, no bleeding, and no nodules. Now I'll check for the frontal sinus and maxillary sinus. Can I touch your head? Okay. As I can see, there is no swelling or tenderness. Now I'll begin with the examination of mouth. Can you open your mouth wide, please? Using the tongue depressor, I'll check the oral mucosa, interdental papillae, and gum margin. Okay, as I can see, there is no swelling, no ulcer, and no change in color. Now I'll palpate your teeth and look for any loose teeth. Can you please open your mouth? Okay, as I can see, these are all good and healthy. Now I'll proceed with the inspection of the heart, palate, tonsils, pharynx, and the location of the uvula using the tongue depressor. Can you please say ah? Say ah.
Ah.
Okay, as I can see, the uvula is in the midline, and the heart palate, the color of the heart palate is also good. Okay. Now I'll do the inspection of the tongue. Can you please put out your tongue? Can you please put out your tongue? Okay. I'll look for the color and symmetry, and the dorsal surface of the tongue is rough due to the presence of papillae. Okay, this looks good. Okay, okay. Now I'll begin with the examination of the neck. Okay, I'll check first for the symmetry of the neck, any masses or scars. Okay. Now I'll look for the thyroid cartilage, cricoid cartilage, and trachea. I'll check for the position and the symmetry of the trachea to see if there is any deviation. As I can see, there is no deviation. Now I'll look for the movement of the trachea and position. Can you please take a sip of water? Yeah, tilt your head up and now swallow. Okay, as I can see, the movement of the trachea is fine. Now, putting the tangential light through the chin of the patient, look for the thyroid cartilage. Okay. Now I'll check the lymph nodes for any swelling. As I can see, there is no swelling. Now I'll check for the deviation and trachea. Take a sip of water. Can you please swallow it? Okay. Okay, as I can see, there is no deviation, tenderness, or swelling. Now I'll check if the thyroid gland is enlarged. I'll listen to the lateral lobe of the thyroid gland. Similarly, on the left side also, and check for any bruit or sound of murmur. Okay. I'm done with the all three physical examination of the nose, mouth and neck, and thank you for your cooperation.